Good morning and welcome to Look and Feel Your Best with Dr. Patrick Flharty. I'm Gina Burch. So this morning we're going to be giving you all kinds of advice on how you can look your best. Therefore, just as a natural progression, if you look good, you're going to feel good. And those two things go hand in hand. Dr. Flharty is the medical director at the Azul Cosmetic Surgery and Medical Spas. There are 3 locations, Fort Myers, Naples, and
Bonita
Springs. Thank you. I almost said Sarasota. I'm doing a premonition for you.
Yes.
They're going to expand northward soon. You're like, great.
Yes.
Let me put more miles on my car, right?
Right.
Well, Dr. Flharty is definitely on the cutting edge when it comes to technology. And one of the things that I love about coming in here, well, there are a lot of things every week, is you really place a high value on education and keeping up on what's going on and what's hot in the fields, regardless of whether it's surgical or non-surgical.
Yeah, that's a key thing. And, I am a surgeon and I love surgery. I spend about half my time in the operating room doing, facelifts and eyelids and, lasers and fat augmentation, the surgical rejuvenation. But the most rapidly growing part of our field is really in the non-surgical realm, things like Botox and fillers and all the new various fillers and the light lasers and things we're doing in the office. And that trend's going to continue as technology gets better and better, as we've seen things become easier and more convenient, and that's going to be true in cosmetic surgery too. I mean, the day may even come where we don't do invasive surgery, that everything's done
crazy
somehow.
Yeah,
it's hard to imagine, but then when you've imagined you run your life off your iPhone,
No, never.
I mean, just first of all having a portable phone and then having a portable phone serve for everything you need, from your schedule management and everything else, internet searches, so it's we'll see that day, I'm sure, and it's happening already in the sense of there's more and more that we can do non-surgically, and so you have to stay on top of the technology. If you don't, you're going to miss the boat. I mean, so many things like Coolsculpting, which we've talked about a lot. I mean, that's going to totally transform the way people deal with extra fat, and because it's completely non-surgical and safe and no downtime and minimal discomfort. And I think when people realize they can get these problem areas reduced, just with a quick office procedure you could do at lunchtime, that's going to evolve and continue to grow in popularity.
Definitely.
Versus things like liposuction, which obviously worked well, but did require surgery and downtime and scheduling and all that stuff. So, we're going to see that continued improvement,
I know one of the other things that you've seen kind of shifting over the years has been, facial rejuvenation has been largely a field that women flock to. And now you're seeing more and more men coming in and saying, okay, it's not a girl thing, and it's a longevity thing, and I care about how I look, and especially if my wife or girlfriend is improving her looks all the time, I don't want to be, left behind here.
Yeah, there's a variety of reasons, and today is the men's show, and we don't give men enough attention here, and so we're trying to do that. And I think for me, now in my 50s, having gone through some of the aging changes that occur over time, makes me a little bit more keenly aware of that. But we've seen a lot of changes in attitudes, societal attitudes towards cosmetic surgery. And when I say that, that's a sort of a generic term, cosmetic enhancement, let's say, because, so much of it is non-surgical now. And so we've seen men now being much more open to coming in and talking about things than in the past, where early in my career, and I've been doing this almost 25 years now, it wasn't that common that men would come in. It was kind of a rarity. And now it's, very common. Right. For things like Botox and fillers and skincare, as well as, surgery, eyelids and face and neck, and all that. And I think, it's interesting to look at. I do think there's slightly different motives, or can be. Obviously there's a big overlap. We are obviously, people are taking more control of their life in terms of living healthier, which comes down to really habits for healthy living, nutrition, exercise, and, attending to your mental health are all things that can help us be healthier and live longer. And I think because of that, people are tending to work longer too, because, work isn't, I think the whole attitude of, you work until you can retire and then you retire. And I'm sure there's some people that's still the game plan. But for many people, I mean, if you've chosen the right profession, or, you have things, even a second profession you may be interested in. And we see that a lot in Florida. People retire at a young age. They come down here, and after a couple of years of like playing golf and playing cards, they're like, oh my God, I'm going to slip my wrist. I got to go do something. And so, it's good to see that at our ages, because we can learn from that and say, okay, we don't, you don't want to quit completely. And, I think, you see people that are working longer, and, there's colleagues of mine in their 70s and even 80s who are still practicing medicine in our community. And I love to see that. I mean, that's really fantastic, because that's just speaks to how we are living longer, and 70 isn't 70 anymore, and 80 isn't 80 anymore. And, it's reasonable for people to continue to stay active if they can, stay healthy and stay current and do a good job. So, and, I think athletically and socially as well, people are living longer, staying active, staying socially active. And so, wanting to look your best, whether it be to, maintain a competitive advantage in the workplace, or to be attractive in the social environment, people who may have lost spouses or been through divorces, those are very common motivating factors for people to want to come in and do some things to help themselves look their best, so they can, look as good as they feel. And, we hear that all the time, because, of course, you can take great care of yourself and eat right and exercise and do all that, but if you don't pay any attention to your looks, your face is going to look a lot older than you feel, and that's just natural. You get sun damage and volume loss and sagging and laxity, and all that leads to us looking older.
Right.
And there's, something we can do for pretty much all of those problems. And so, it makes sense for people to want to do things to look as good as they feel.
Right. And as you said, there are so many different things you can do, and it doesn't have to be complicated. I mean, we're just talking, especially for a lot of men, just some basic skincare, since we're focusing on men. I think, as women, as I was growing up, I was always told about moisturizer and cleansing and all of these things. And I don't know that men or young boys and adolescents, kind of had that ingrained in them growing up on the football field, on the track, in the pool. And so that's something that if a man has never done that ever in his life, could make a big change, right? Right,
for sure. And, it's funny that you mentioned that, because what I think about back to my experience with, quote, skincare, end quote, it really was Clearasil, I mean, putting little something on those acne pimples to try to solve your acne problem, and that was it. There was nothing about a cleanser or a moisturizer or anything else, and even when we were young, I guess, my parents were wise enough to say, hey, listen, you're going to play tennis all day, put on the sunblock. So I did get that, at least. My father was a physician, and so they were, pretty well versed on protecting your skin. But, that was it. But, that's still a lot, being able to protect your skin. But and sunblock, and we'll talk a lot about that today, because I think that's one of the key things. But I think, men now are starting to recognize the value of skincare. So you say, okay, well, what can I do? Or, okay, yeah, sure, I want to look my best, but, what does that entail? I'm not sure I want to, do surgery or even do Botox or fillers. Well, you can start with skincare, which is completely painless, completely non-invasive, and can make a huge difference in how you look. And, I kind of know that now firsthand, because we've got a product line that we've developed over the last 10 years, and I use that line, and it makes a big difference. It really makes a difference. And of course, till you get to an age where your skin starts to change, you probably don't realize that, but it can make a big difference. And we do see more men coming in. I think it's an unmet need. I think a lot of men could benefit from skincare that haven't really thought about it, but it's simple to do. It's very relaxing. It's almost like a facial massage, where you can really kind of close your eyes and even fall asleep and relax while your skin is being rejuvenated. And, things are directed, always here at Azul, we're focused on, we want these treatments to be, pleasant and enjoyable, but they have to be effective. We want them to make a difference for you. And so, basic skincare, which can include things like the HydraFacial, and, we'll talk a little more about that, but that's a great technology technology to help cleanse the skin, exfoliate the skin, and help to build new collagen and elastin is a great treatment. And then that can be combined with a topical treatment, which can be antioxidants like vitamin A or some of the rejuvenating proteins like growth factors or peptides, and of course hyaluronic acid, which is a great plumping protein that can help add moisture back into the skin. Just with a simple office treatment like that that's relaxing and feels like a relaxing facial massage, you end up with this beautiful new plumped smooth skin that looks great and really can make a difference in how you look. And I know that from personal experience, because going from no skincare to all of a sudden now using some products, nothing complicated, people go, wow, your skin looks great. What do you use? And that's something you usually hear as a guy, but you can, because there's ways to make your skin look better, and it's worth exploring that. And that's easy to do, easy to fit into even a busy schedule, and can make a difference. And a lot of that is just done with home products, so you don't have to be running into the office all the time. Just things you put on in the morning after you shave, and in the evening before you go to bed.
Yeah, I definitely want to talk about the home products a little bit too, because there might be some men who are still a little bit intimidated to come into an office to get a facial or some laser type of surgery. So it's basic. I mean, it's cleansing and exfoliating and hydrating, right?
Right. Those are the big things. And for men, skin is thicker, and you might see more aging changes and sort of dry, scaly skin because they haven't done a good job of taking care of it. So exfoliating is important, which can be part of a cleansing routine, just a cleanser that does exfoliate, and hydrating, and then protecting with sunblock. I mean, those three things, you don't have to have it be complicated, can make a huge difference.
Okay. Yeah. Let's talk a little bit more about skincare, and maybe we can go into a little more depth with maybe transitioning into some laser technology as well.
Sure, let's do that.
Okay, we're going to take a quick break and get some coffee here, and maybe you can do the same thing, and we'll be back with more of Look and Feel Your Best with Dr. Patrick Flharty. Welcome back to Look and Feel Your Best with Dr. Patrick Flharty. I'm Gina Burch, and this morning it's all about the guys. Gentlemen, we are tailoring this show to you, and because all of the treatments that Dr. Flharty does at the Azul Cosmetic Surgery and Medical Spa are unisex, I guess. I mean, they're good for both men and women, and it's typically been something that I think more women do than men, but that's changing. Yeah,
that's changing. Men are definitely more open to coming in and talking about things. I mean, I think a lot of men are really interested in it, but, a little bit afraid and intimidated by it. But really, there's so much that can be done now that is easy to do and non-surgical and no downtime. So it's not, once you kind of know what can be done, it really does open up a lot of possibilities. And so we're seeing more men coming in. And like I said, we're talking about skincare, which is
the basics, right?
It's the basics and something that probably most men think, well, I don't really even need that. So why would I do that? But then, it does make a difference, and it's a simple way to make your skin look better. And if your skin is, moister, plumper, more elastic, if you can get rid of the dry, scaly surface of the skin, it softens the skin, it plumps it up, it makes it look healthier, has better color and texture. A lot of the fine lines and creases can go away just with skincare. So it can really make you look younger and healthier just doing skincare.
And I can see some guys sitting here thinking, I see what my wife or my girlfriend or my significant other has in the medicine cabinet. And there's a serum and there's a peptide and there's this and there's that. And I just don't want to do all of that. And you don't have to. It can be very simple. But then you add some of those other things in there and it can really boost everything to another level.
Yeah. And, as we've built out our skincare line, it's interesting because, my wife, Kristen, has got a doctoral pharmacy degree, and she has her own lab, Trilogy Laboratories, where she makes, the majority of our skincare products. And, we constantly have this dialogue. And from the very beginning, really even 15 years ago or 20 years ago, I would say, we'd just have the dialogue. I would be like, I'm not going to do 5 things, I mean, I might do a couple. You could maybe get me to do a cleanser and a moisturizer and sunblock. So, we've had this dialogue, but I think most men feel the same way. It's like, well, yeah, sure, they want to look better, but they're not going to do 5 steps every morning and 5 steps every night. So, I think, practically speaking, there is some very simple things you can do. It doesn't have to be complex. It can get complex if you want to get more complex. There's so much that can be done. And so for some people, they've developed regimens that really work for them. And I would say women have been more attuned to that than men in general. But for men, there's just simple steps, as we talked about. A cleanser, which can serve as an exfoliator, which can really help get rid of the dead surface cells. You can add a rejuvenating product like a growth factor or a peptide, which can make a really nice difference in growing collagen and making the skin thicker and more elastic and healthier. Then using a moisturizer, as we mentioned, that can give you instant improvement in just the texture and quality of the skin. And lastly, sunblock, which is, super important just to protect the skin and prevent sun damage and, ultimately prevent skin cancer formation. That's really important.
So that's an easy start, something that you can do at home. But when you come into the office, you've mentioned the HydraFacial. You've got all kinds of peels and things here that kind of go a little bit deeper to get rid of some of that damaged, aged skin. Yeah,
so we can accelerate that rejuvenating process through topical treatments, such as the HydraFacial and dermablading and some micro peels and things that can really jumpstart it and get it going, and to stimulate the skin kind of at intervals throughout the year, so that it's your body adjusts to whatever you're exposing it to. So the same regimen over time becomes a little bit less effective. So you have to mix it up a little bit. But again, the regimen at home can be pretty simple. It can be just basically 2 steps: a cleanser and kind of a moisturizing sunblock maybe in the morning, and then a cleanser with a rejuvenating product like a growth factor in the evening. And those 2 things can make your skin look tremendously better, smoother, softer, reduce wrinkles and lines, reduce some sun damage. It can help.
And then if you really want to get serious about getting rid of some of those wrinkles and shrinking those pores and those spots on your face, you've got a whole array of lasers and laser-like equipment that can really make a big difference as well.
Right. And one of the really popular ones for us here in Florida and really nationwide and worldwide is what's called IPL, intense pulse light. Sometimes it goes by the name BBL or broadband light, and it's considered a laser. It's not truly a laser because it's not coherent light energy. It's actually visible light that's delivered through a handpiece, and it's a broad spectrum of visible light that's controlled by filters, so we can filter out the wavelengths we don't want and get a range of wavelengths, and those are absorbed by different pigments in the skin. And the key with that is the reds and the browns. So as we age, a couple things happen. We start to accumulate some sunspots. We get irregular pigment distribution in the skin, and that's what can lead to these brown spots. And we see more reds, like dilated vessels. Me in particular, if you're Celtic or of that background, fair skinned, especially down here in Florida, you'll start to get a little bit more redness of the skin with age, which is broken capillary and dilated vessels that occur that can make your skin look red. If you have rosacea, that can really accelerate that. And so this IPL treatment targets the reds and the browns with this light energy that's delivered through a crystal handpiece that sits on the skin. So we put a little gel on the skin, put the handpiece on, it just delivers a quick flash. Kind of feels like a rubber band snap. As you can tell, I've had that treatment done.
Yeah.
I probably need to do it more frequently, but it really helps to reduce some of the redness. And there's really no downtime. The beauty of this instrument is that it delivers the energy. That energy is absorbed by the pigment in the skin, the reds and the browns, so it'll shrink the vessels and close most of the small vessels off, and it'll be absorbed by the pigment and turn those spots dark brown, and then they come to the surface and they actually flake off over the course of a week or 2. So the brown spots look worse before they look better, but there's no removal of the skin. It's not like an invasive laser peel or a chemical peel where you're taking off the skin to improve the texture. With this, you're just shrinking the vessels or closing the vessels, which eliminates some of the reds, and you're lifting the brown spots out, or most of the brown spots, which removes the browns. And no downtime. I mean, I've done this at lunch hour before and gone back to see patients in the afternoon, and you're a little bit red and a little bit puffy and red for a few hours. That's it.
And then does this also help? I know this helps with the appearance of the skin, but does it also do anything for wrinkles, or is it mostly just the pigments that we were talking about?
So it does, primarily its real benefit is the pigments, the browns and reds, but it does have some other beneficial effects. It does shrink pores a little bit, which is great, because I think it affects the sebaceous glands, and our sebaceous glands on our face tend to get hypertrophied with age, and our oil glands get bigger and the glands get bigger. That's why our nose grows a little bit, all those sebaceous glands.
It's not because we're telling a white lie.
Well, it could be that too. But anyway, so that's helpful. That's an added benefit, and it will tighten the skin and reduce fine lines and wrinkles as well. So there are some other added benefits of that treatment.
Okay. Is there another type of laser that's or type of equipment like this that would be good for men?
Yeah. So another, an area that might be of interest to men is, acne scarring. And we have a lot of office-based treatments for acne scarring. I like doing fillers to fill those in, which is just small little injections. But on the laser front, we have a non-ablative fractional laser that works well for acne scarring, usually improves it by about 50%. That's a series of treatments. We also use some radio frequency delivered through microneedling to help reduce acne scarring. So both of those kind of treatments are done in the office with really little or no downtime. You're not removing the surface of the skin. You don't really need to put Vaseline on there or anything. With those treatments, you could have a little bit of redness or discoloration, maybe a little swelling for a day or two. And that's it. So it doesn't interfere with your work routine.
Okay. So obviously, acne scars on the face are a problem for many people. They can be embarrassing. What about on the back and other areas of the body? Can these treatments be used in other locations?
Some of the treatments can be, both of those. Because they are non-invasive, you can really use them anywhere on the body, and so we do sometimes use them on the other areas of the body to tighten the skin and reduce wrinkles. Obviously for most people with acne scarring, they're mainly concerned about the face. That's sort of the high priority. And we, again, now have a number of tools, and if we use several of these in combination, like some of these lasers to tighten the skin and fillers, it's a 1-2 punch that works really well, and you can really reduce acne scarring. And in the past it was dermabrasion or laser resurfacing, which were big procedures that required a week or two of downtime and then redness for a couple of months. We don't do that anymore for acne scarring because we have techniques that work just as well or better that are non-invasive. And again, that's another example of where technology is transforming the way we do it, making it better. Yeah.
Since you've kind of mentioned fillers, I want to dip my toe into something here before we take another break, and that's the Botox and the fillers. Did I hear you somewhere or see where you mentioned you were calling Botox for men Brotox?
Yeah, I don't know who came up with that. It wasn't me. I won't take credit for that, but I love that term, Brotox. So Botox is very popular with men, and that's probably one of the things that brings men in a lot. If you get that frown line between your eyebrows, which would be the most common area we treat, that's something that it can occur over time, if just from concentrating or straining, or anytime we have that serious concern look, we tend to activate those muscles and get that little crease, and that can get to be a deep crease that makes us look angry. It's kind of an intimidating thing, and there's maybe some benefit to having that to intimidate people, but if that's what you want. But for the most part, it kind of puts people on a little bit of alarm. When you see somebody that's got kind of that frown, your first reaction is sort of step back a little bit, like trying to assess that. And, when you take that away, it makes people just look much more pleasant and approachable, and it's same person, they're not any different. But the appearance and the first impression is quite a bit different, when you have a big frown line or a scowl versus just the smooth appearance there. And it's amazing. What I love is, the men first time coming in, maybe 35, and they have a frown line between their brow, and they've got these horizontal lines in their forehead, and they're kind of hesitant and nervous. And we always laugh because, men, are like, well, is this going to hurt? And we have tiny little needles for Botox now. They're 33 gauge.
Hardly feel them.
Yeah, you hardly feel them. But of course, they're nervous because they don't know what to expect. Right. Fear of the unknown, like we all have, right? So, we do numbing cream for 20 minutes. We do the injections. And they're like, wow, is that it? Yep, that's it. And then, why don't you come back in 2 weeks? Let's see how it looks. And then they come in and they're like, oh my God, it's unbelievable. They're amazed. I mean, it's transforming, and so especially for people who have, real active, brows and foreheads, and all of a sudden these lines that were just a permanent part of their facial expression are gone. And it just really, really makes people look younger and more pleasant and more approachable. And it's really a powerful effect that's simple to do with a couple little injections. Okay. And so, people joke about Botox all the time, but there's a reason it continues to grow in popularity and is by far and away the most common treatment we do annually because it works.
We're going to talk a little bit more about Botox and go into the world of fillers when we come back. We're going to take a quick break. You're listening to Look and Feel Your Best with Dr. Patrick Flharty. I'm Gina Burch. Welcome back to Look and Feel Your Best with Dr. Patrick Flharty. I'm Gina Burch, and this morning we are focusing on men. And, of course, everything we're talking about here can be translated into for women as well. All of these procedures are they go both ways.
Sure. Everything we are talking about can be used for women as well as men. But interestingly, men tend to come in for slightly different set of reasons than women, and that's why I think it's important to talk about it, because I do find that the sets of treatments that are most common with men can be slightly different than those that women are looking for.
And we want to ease the anxiety of a lot of men who might have been toying with this or thinking about it, and it's like, hey, you know what? It's very simple, and Dr. Flharty is going to take care of you. And Botox was, I love it. Brotox is one of the reasons. and we were specifically talking about the 11s, that frown line right in the middle of your brow. But Botox can also be used for men for the wrinkles in their forehead.
Right.
And you don't have to erase it to make it a clean slate. You can do it subtly. So if they still want to have a little bit of that age look or that wisdom or whatever men perceive that to be, they could still have that, right?
Right. So yeah, Botox is very adjustable and individualized. You can make it completely smooth, or you can make it partially smooth, just soften the lines. And then the crow's feet, which are the kind of the lines that radiate out from the corner of our eyes, sort of on the outside of the eyes. We can soften those too. Sometimes I think people, again, fear, if I have something done, I'm going to look different or weird. That's, not true. It's, all technique driven. Botox not done in the right pattern for a man could give them an arch brow.
Right.
Things, but those things are completely avoidable with good technique and understanding the pattern for male, brow shape and contour. So that's the most common area between our eyebrows, our forehead, and around our eyes for men. And that makes a big difference, and very popular treatment with men. But also now with the fillers, what we call the liquid facelift, we can now address some of the aging changes of the lower face with men. And that would be what we call the nasolabial folds, which are the folds that go from the corner of the nose down to the corner of the mouth, and what I call labial mandibular lines, kind of the frown lines that occur from the corner of the mouth down to the jawline. And there we can use fillers to soften those lines. Which are very complementary to the fillers on the upper part of the face. So much of the aging of the upper part of the face you'll see is, frown lines between our brows, horizontal creases in the forehead, crow's feet. You can soften those with Botox. And Botox lasts about 4 months, but you can actually stretch the interval to even 6 months, a couple times a year, keeps that area softer, makes it smoother, eliminates the wrinkles. And certainly if you don't do anything, those wrinkles are going to get deeper and deeper. And then we can do fillers for the frown lines around the mouth, which can make a big difference. Instead of, again, looking like we're frowning all the time, it gives us more of a neutral shape and makes us look much more pleasant and approachable.
Right. And I remember a show many, many months ago where we had danced around the subject of how there were studies that showed that Botox actually did something psychologically to people. It for people who were suffering with some depression or anxiety, and they weren't really sure if it was the chemical or the residual or the effect of the treatment, where people being more friendly and open and approaching them because they're more approachable because they don't look angry and mad all the time.
Exactly. Yeah. There's at least 5 studies that have shown an improvement in depression with Botox, and specifically it's between the eyebrows.
Okay.
And it's interesting because like around the eyes, the crow's feet, it didn't really have an effect with that because that's more subtle improvement. But if you think about it, if you have that frown line between your eyebrow, that makes you look angry.
Right.
And that causes people, again, as I mentioned, when you see somebody like that, you're a little bit on guard. It may be totally self-conscious, but you're kind of okay, you're not sure.
Sure,
right? And, if it's somebody who becomes your best friend and you know what they're like, then that doesn't intimidate you anymore. But for people you're just meeting, it does have an effect, right? And so if you take that away and you're meeting that same person with or without a frown line, your approach to that person is going to be different.
Totally different.
Even if you're not thinking it's different, it is different. Because if somebody looks smooth there and very pleasant and approachable, you're going to treat them differently. So there are several theories as to why would Botox between your eyebrows affect depression. And, obviously there could be some kind of biochemical effect that we don't understand going on. That's possible, but nobody knows of that. The other second part with theory was if you look in the mirror and you look more pleasant, then you feel happier about the way you look, and that may change your mood, and that's possible.
It changes your whole energy, really.
Right, right. And the third one is really, which I think is the most plausible one, is that because you look more pleasant and approachable and happier versus angry, people treat you differently. And that, in turn, makes you feel better. Because we all know, if you ever had a day where everywhere you go, people are like, oh, hey, great to see you. You look great. Love that dress. You're looking, whatever. Those days where you maybe look really great and people...
You're like, yeah. We conquer the world today.
Those are great days to have because you feel on top of the world, right? So when people treat you better, even though people say, oh, well, that doesn't matter to me, it does matter. It makes a difference in how you feel about yourself when other people are complimentary or just more engaging, just because you're more approachable and more engaging. So I think that's the most likely cause of that. So it's a powerful thing when you think about a small little Botox between your eyebrows. A couple little injections can affect the way people treat you. That's pretty impressive, and in turn affect the way you feel about yourself.
Exactly. And for the men who are thinking, well, and you touched on this briefly at the beginning of the segment, that they didn't want to look like something had been done. You want to look natural. Again, you are an artist when it comes to these fillers, and you could just put just a little in just to soften it enough where people will look at you and say, wow, you look fresher. Did you get sleep? Something's different. Did you lose weight? Something different to your hair. They're not going to zone in and say, wow, your frown lines are a little less deep than they were last week.
Right. And, with cosmetic procedures, there's a lot of subtleties and nuance, and it's very important. And that's true of whether you're talking about Botox and fillers or, eyelid surgery and brow lifts and facelifts. Technique is really, really important. And you can look better without looking different. You can look better without looking unnatural, and that's really important for people to understand. And they don't fully understand it until they actually start doing the things. Right. But it is funny when you see the switch. And for a man, it can be just a simple treatment of Botox, and they're like, "Wow, I had no idea that something this simple could make such a big difference." You know, so that's the really fun part of it is all these great tools we have to help people look better and feel better.
And with the fillers, let's say you're doing that little crease from your nose to your mouth, to the corner of your mouth, or maybe even someplace around your eyes. The other cool thing is when you do one side, you can give the guy the mirror and he can see the difference. I mean, it's immediate with fillers.
With fillers, it's immediate. With Botox, it takes a few days to see the effect. But yeah, it's really fun to do that, to do one side with fillers and show them. Because once you do both sides, again, they forget. That's why we have photos to show, oh, no, here was your dark circles that we took away. Oh, yeah, now I remember. Because you do forget. And again, as long as you look natural, you look healthier and younger, but nobody's like, oh, your dark circles are gone, because people forget you even had them. So it's this, those things are erased physically and in everybody's mind, including your own mind. It's quite remarkable with some of these changes, even in a week or two, people forget. And then you pull out the photos and like, oh my God, I forgot that's how I looked. But the other areas we didn't talk about fillers, which I think we need to address before we move on, is, the lower lid mid face. So for men, that's a common area. So dark circles under the eyes, which are quite common, you can fill those with fillers in the office, no downtime, and, you know, reduce or eliminate those dark circles can make a huge difference. Instead of looking constantly tired all the time, you take that away. And then in the mid-face, which is sort of the area just under the eye, for men, they tend to get very flat or hollow in there. And that's just you know, we lose fat from our face with age, so we get thinner and more gaunt-like. And that hollowness or flatness there can make us look just tired or older. And so just putting one of our deeper fillers in, which can add volume and shape to the face, can give you a little more filling and rounding of the cheek, which can really make men look younger and healthier. And it's different for men and women. This is an area where it's different. You know, for women, you know, a higher arched cheekbone can look really good, and it's something that we often want to kind of highlight or
all
accentuate.
the models have those nice high cheekbones.
Right. But with men, you know, usually that's not the case. We're not trying to accentuate the high cheekbone, which can be a little feminine, but it's the area kind of right under the eye, what we call the medial mid-face. That area, when it gets flat, just makes us look tired or older. It gets shadowy, and all the lines are going down. It makes us look, you know, old and tired. And we fill that in. It gives us that sort of roundness of the cheek that makes us look youthful and vital and healthy. And it's a very subtle change, but a powerful change and easy to do in the office.
And that filler, not only does it make you look more youthful, it just because you're pumping up the volume a little bit, one of the side effects is it kind of smooths out some of those fine lines and wrinkles, right?
It does. By filling that in, it can help stretch the skin a little bit and smooth it out, because part of the skin laxity comes from volume loss. It's like the balloon that loses air and gets wrinkled. We use that analogy a lot, but it's super important. As you add volume back, the skin is tighter and smoother and looks good. And it also helps the folds, you know, the folds below, the nasolabial folds and the jowling. If you fill the mid-face back up, it lifts the cheek, makes you look younger and healthier, tightens the jowl, reduces the nasolabial fold. So there's a bunch of indirect effects from that look really good.
Right. And one good thing before we take a break here, some of the fillers, so I know, like we were talking about the fear of the unknown, and if somebody says, a man listening thinking, what if it's too much? What if I don't like it? Some of the fillers you use can also be reversed because of the type of substance they are. Yeah,
it's rare that we ever have to do that, but hyaluronic acid fillers are very safe. It's a natural product. It'll last anywhere from 6 months to a couple years. It's gel-like. It's not foreign to the body, and we do have an enzyme to dissolve it. So sometimes under the eyes, if it gets too plumpy or too full, we can dissolve part of it to smooth it out. So you can add and subtract, which gives you a lot of control.
Right, and it gives people sometimes that just that little moment of a breathing, like, okay, I can, I have an out. Some people just want that out. Yeah,
peace of mind. Yes.
You're listening to Look and Feel Your Best with Dr. Patrick Flharty. We're going to take a quick break, and when we come back, I want you to tell men how they can get rid of those love handles, those annoying love handles. Okay?
Yes, we'll do that.
All right, we'll be right back. Welcome back to Look and Feel Your Best with Dr. Patrick Flharty. I'm Gina Burch. We're talking this morning about men and some of the procedures and I guess instruments and equipment and skincare and things that can help men specifically look younger and feel their best. Turn back the hands of time.
Yeah, and I think, we could relabel this simple things for men, because really what we're looking at is really non-invasive surgery, non-invasive procedures, no downtime procedures. They can really make a difference. So, we talked about skincare and the importance of that, and that's really simple. It can be a matter of just doing, a 5-minute routine in the morning and night, just with a cleanser and a moisturizer and sunblock, and some rejuvenating products at bedtime. We talked about IPL to lift the reds and browns out of the skin, which is a nice office-based laser with no downtime that can really help with sunspots and broken capillaries and just clean up those reds and browns very naturally, again, with no downtime. And then we just finished talking about Botox and fillers, and that's, very popular and really works great for men, middle-aged to elderly men, to help replace lost volume, reduce dark circles, fill in lines and creases, reduce the tension in the forehead and frown lines. And becoming, more and more popular for men to do. So, these things are all really easy to do kind of in the office and, at home on your own, and no downtime, and can make make you look, years younger and healthier. So it's important.
So we're talking about, losing volume and losing fat in your face. But we seem to have it in other places that we just can't get rid of it when we age. And this is a problem that men and women have. And you've got a new body. Well, it's not new, super new, but you've upgraded it, the Coolsculpting. It's a body contouring device that can help you get rid of that stubborn fat that's just annoying, and it won't go away no matter how much you diet, no matter how many miles you run or how many hours of tennis you play. You still have that little bit lapping over your belt. And it's like, how do I get rid of that?
Right. Right. So Coolsculpting is, think without question, one of the best non-invasive technologies to come along, ever in, cosmetic surgery realm. We own a lot of lasers here, and we use a lot of lasers and devices on a daily basis. But Coolsculpting is amazing in the terms of how safe it is, how quick it is, how effective it is, and minimal discomfort. It wins on all those fronts. We have some technologies that can give you some improvement in things, but are uncomfortable, and there's always certain downsides, and some people respond really well and some not as well. Coolsculpting, and nothing is perfect, of course, but Coolsculpting is greater than 90% effective, which means, greater than 90% of the people have a really good visible result. And it's what it is. It's called cryolipolysis. That's just a way that we destroy fat cells with freezing. And by, if you can squeeze it, you can freeze it. So when you think about the body, and as we age, our bodies change a little bit, and we accumulate fat in areas we don't necessarily want to, and they're hard to lose fat, especially abdomen, love handles, under the chin can be a problem. And, I've kind of lived through this personally because I've always been, slim and athletic, and did triathlons for many years, still kind of run, bike, swim, lift weights, virtually almost, every day I do some type of workout, and, stay pretty fit. And, I'm pretty close to my ideal body weight, but my body had changed over, from the 20s, 30s to now in the 50s, a little extra fullness in the lower abdomen, a little extra fullness on the love handles. And, when this technology came along and we looked at it and I ended up buying it, I was like, well, I'm trying it. And, I always laugh.
Me first.
Yeah. Which is lining up behind the rest of my staff, right? So, it's funny because, you can tell, based on your staff's utilization, what's really great and what isn't. Everybody on our staff has Botox, 100%. And, probably, almost everybody's had Coolsculpting multiple times.
Right.
So, one of the benefits of working here is you have access to all these great technologies, and that's great. I want people who care about that stuff and believe in it, so it's good. But, so for me, which, often I kind of ignore myself, and, one of the girls will say, oh, I think you're ready for Botox or something. But with that area, I was like, well, I want to try this and see how this works.
Right.
And it was amazing how well it worked. It's a simple procedure. And you mentioned the new technology. We now have the new Cool Advantage. So the great thing about the Coolsculpting platform is the company that developed it was very committed to constant improvement and making it better. So it worked well in the beginning, and it even works better now. They've developed some new applications that we can use it in different body areas, like under the chin, and it's faster, and there's less discomfort, and it works better. And the company even doesn't promote that as aggressively as they should. And I think the reason is a lot of people bought into the original platform and didn't, have the money or didn't want to upgrade. And so they don't want to advertise, oh, you got to have the new Cool Advantage, because the people that bought their first machine, they don't want to be throwing them under the bus, so to speak. But the reality is the new equipment works way better. We've upgraded all of our machines, and I'm so glad we did it because it's quicker, it's more effective, and less discomfort. So I had original treatment of my lower abdomen and flanks with the original equipment, and there was a little discomfort in the abdomen, almost none on the flanks. Good results all the way across, over the next month, that area just flattened out. And so for people who don't know what this is, how this works, you basically just do it in the office. There's no injections. It's completely non-invasive. They, apply the machine to the area of interest. So
it's like a little suction cup?
Yeah, it's like a little suction cup that fits over, and there's different sizes and shapes just depending on which area you're treating. So they put it over, let's say, the lower abdomen or flank area, and then it freezes that area. It just like pinches it and freezes it. You sit there for an hour. Originally, it was an hour. Now the new machine is 35 minutes. And then they take it off, massage it out, and there's a little redness and swelling in the area. There's not really any discomfort once it's done, other than you might have a little sensitivity. There might be a little numbness. Sometimes the first treatment I had, it was a little bit uncomfortable, kind of just felt a little bit funny in the abdomen for about an hour or two, and then that went away. And then it was just like a subtle little bit of redness and swelling, and when you would shower, you could feel that skin was slightly numb compared to the other areas. So you could tell you had something done, but only when you were touching it, not otherwise. No restriction on your activity. You can go back and work out the next day and all that, so it's great. And then, I just, like most things, I forgot that I'd even had it done. And then like a month later, I was just getting out of the shower one day and I looked in the mirror and it was like, oh my gosh, it's flat now.
Wow,
it's like gone away. And so then several years later, when we got the new technology, I was like, well, I could, I had treated the flanks in the front part, but the back part was now, the front had shrunk down, but the back kind of around, as you go around the back, was a little bit full relative to this front. So I was like, well, gee, I could treat that now to help that blend in. So I treated that with the new Cool Advantage. And I did a second treatment in my lower abdomen just to shrink it a little bit more. And man, it was amazing. That one, there was like no discomfort, 35 minutes, and within a couple of weeks, I could see a result. So that's the new Cool Advantage, which works even better. Like I said, it's quicker. And they made the cups more shallow. There's not as much suction, so there's not as much discomfort. And there's even cooling within the whole cup. So the cooling apparatus has been improved. So there's better cooling, which means better results, more fat loss.
So for somebody listening to this and they've heard it for the first time, or they may have heard it but not really quite understood it. So we're talking about the cups and what they do, but basically it freezes your fat and your body eliminates it, right?
Right. So it freezes the fat and it freezes it to a temperature that doesn't damage the skin or the muscles or the nerves, but does trigger some of the fat cells to die. That's called apoptosis, cell death. And those cells will just fall apart and be reabsorbed by your body. So that's a really important point because it is permanent. Again, most people think, oh, well, if it's just freezing fat, you're just trying to shrink it down. Right. It's not shrinking.
And they're going to come back to life and they're going to be pissed off.
Yeah. Right.
And they're going to be twice as big.
Yeah, they're going to come back and get you.
Yeah.
So no, it's permanent. And you get about 20 to 25% of the fat cells that are frozen will die and disappear. And it's very gradual and sort of natural. So those cells will just sort of break up. They're reabsorbed by your system and, they're gone. And so it's permanent. So that's really important because you're eliminating fat cells that are gone forever, just like you do with liposuction, but without surgery. So that's pretty remarkable if you really think about that, reflect on that, because you're not just shrinking the tissue, you're eliminating fat cells. So that's permanent. One of the important points is that if you're working out and you're, taking care of yourself and your weight is stable, then you'll see really nice results in this case. But obviously you can't do this and go, oh, well, I'm just going to shrink it with Coolsculpting so I can eat and drink what I want, and you put on 10 pounds, you're not going to see a result or as good of a result because there's fewer cells, but those fat cells can get bigger.
Right.
And that's how when we put on weight, if we eat more, our fat cells get bigger. If we diet, they get smaller, but you're not eliminating fat cells when you diet. But when you do Coolsculpting or you do liposuction, you are permanently eliminating fat cells. So it is permanent, and that's a really important point.
And for men, the Coolsculpting treatment, we mentioned the abdominal region, the flanks around the backside, anything that's going to kind of go over your belt, and the chin.
And the chin. Those are the popular areas for men. For women, inner thighs, outer thighs, back of the arms, back fat, bra fat up, where our bra, sometimes we get the bunching between the shoulder and the bra. But men, enlarged breasts we treat a lot. Men get gynecomastia because they tend to accumulate fat in the breast area. And so you can shrink that fat too. We do those quite commonly to shrink down extra fat in the breast area. So it's really a great body contouring technique, completely non-invasive, highly effective, minimal discomfort. Like I said, I think once people really understand how well it works, a lot more, there's a lot of people that have these little problem areas that wouldn't seek out liposuction, wouldn't do surgery. Like I wouldn't have done that. I wouldn't have done liposuction because it wasn't that big of a problem. But when you have a device, you can do it in 35 minutes. It's like, I'll try that.
Yeah, I'm
Why
in.
not? So it's really, again, it's a great treatment, and more men are coming in for that. It's a really common treatment for men.
Well, thanks for, hopefully you've eased some of the fears and educated a lot of our male listeners and women as well. They can come into the office for a consultation and find out about all of these things, from skincare to the Botox to the lasers to the Coolsculpting. All you have to do is give Dr. Flharty a call, the Azul Cosmetic Surgery and Medical Spa, 239-415-7576. That's 415-7576. Online, it's azulbeauty.com. Offices in Fort Myers, Bonita Springs, and Naples. So, Dr. Flharty, thank you so much. I had fun this morning.
Thank you, Gina. Yeah, it was a fun morning. We should focus on men more often.
Maybe we should. I'm all for it. You're listening to Look and Feel Your Best with Dr. Patrick Flharty. I'm Gina Burch. We'll be back next week.